Hi, this is Dr. Jenny Byrne. Welcome to another question I get frequently as a healthcare leader. And if you're a healthcare leader, maybe you get asked this too. So, I've had a lot of leadership positions where another leader superior to me has said things like, just do what's right for the patient and everything will work out okay. And I don't know if you've heard this one before. I think the true question here is, how do you balance your professional value set as a clinician with the real world, pragmatic, financial, and operational constraints of the world that we live in, which are real? And my answer to this, I'm curious to get your answer as well, but my answer is this. I firmly believe, after having solopreneur'd my own practice, worked at many different companies of different sizes, and helping them to figure out how to design their clinical programming, that the financial model that underlies the clinical work is critical. If the financial model is faulty, the clinical work will suffer, and it will either be um, consciously or subconsciously. I've seen where financial modeling really subconsciously affects the behavior of clinicians. And it's been funny because I've seen it do it to myself. So, for example, I've seen a financial model that's based purely on productivity, where new patients, you get paid more to see a new patient because that's what the company gets paid more. So I have seen my own behavior change subconsciously, where I will try to get in as many new patients as possible to drive up my revenue. I have seen the opposite of that when the financial model is a salaried model, that clinicians, including myself, I've done this, will subconsciously keep patients, quote unquote, too long, even though they don't really need to keep seeing me as a specialist, because they're kind of easy and I can fill my allotted time, because as a salaried employment, it's typically based on the work day and the number of people you see. So my schedule will follow up with established patients that are kind of easy. And honestly, maybe they don't need to see me anymore. They could probably be managed by primary care. But it's easy to just kind of keep them on my schedule. They like me, I like them. They're happy to kind of come in and check in with me. So I've seen my own behavior be impacted by the financial modeling. So when people say do what's right for the patient and everything will else work out, I don't know. I used to resonate with that as a clinician when I was earlier in leadership positions, because I was really happy to hear clinical leaders take this kind of very ethical, highbrow position on what it means to run a company. But having been around a little longer and seen myself and my behavior, I I don't think it's as simple as that. I don't think just saying do the right thing for the patient, everything will work out, because you can have clinicians doing everything right for the patient, and if that financial model or that operational model supporting them is faulty, it doesn't matter. Your company will still fall apart, and then nobody will get care. So that doesn't really help anybody. So I guess I would challenge that statement. I'd be curious to see, have you ever heard anyone say that, or what's your experience? If you disagree with me, I would love to hear why. I'd be super curious about your experiences. Thanks.